Hi, I'm Steve Carrera, and I am the Director of Neuropsychology for the Care Center. Welcome. We're so excited you've chosen to learn more about brain health as it relates to Alzheimer's disease and related dementias. By pressing play, you've shown your dedication to improving the quality of life for yourself, family members, friends, and your community. Let's talk about something I am sure many of you are wondering. Who is most likely to get one of the dementias? Many of you may have had a family member who has dementia, or might be a little worried about whether you are at risk. As far as we know, anyone can get one of the dementias. You can do all the right things and still get one of them. That said, we can change your behavior and change our risk. We can lower our risk. So let's talk more about risk. There are two major types of risk factors for dementias. Non-modifiable risk factors, which are things that you can't really change, and modifiable risk factors, which are things you can change. So let's start by talking about the non-modifiable risk factors. These are things like family history, genetics, and age. Regarding family history, diseases can run in families for many reasons, like the fact that members of a family tend to eat the same foods, live in the same areas, do the similar things. While you can't change your family's history of a disease, knowing that the disease runs in your family is important. If family members have had the disease, you are also more likely to have it. Genetics are another reason that diseases tend to run in families. While you can't change your genes, you're born with them, healthy behaviors like exercising, eating a nutritious diet, sleeping, and averting stress can change the way genes express themselves. Age is the single biggest risk factor for Alzheimer's disease because over time, we accumulate damage to our brains. There's nothing we can do about it. We get sick and we recover. We don't always sleep right. We don't always eat right. We might get medical problems like high blood pressure. All those little hits we take through the years tend to add up and increase our risk. Because non-modifiable risk factors are largely outside of our control, it is important to address those risk factors we have influence over. So, those are known as the modifiable risk factors. These risk factors are a poor diet, chronic stress, sleep problems, and lack of exercise. It's important to remember that all of these risk factors make a difference, and it's important to plan to improve as many as you can. You can learn more about these in depth in other videos in our Brain Health series. Making just a few small lifestyle changes can significantly delay the onset of dementias, stir their progression if you have them, and in many cases, even prevent them from developing at all. Dementias can start developing decades before symptoms start to show. So the sooner you change your lifestyle to lower your risk, the better. But remember that even if you are hearing all of this for the first time, it's not too late to change your behavior and make a difference. Improving your health doesn't only help you delay or prevent dementias, it makes you feel better and improves your cognitive function now.